Good afternoon, everyone, and welcome back, and welcome to this media availability today. And for today's update, I will turn it over now to our Chief Medical Officer, Dr. Janice Fitzgerald.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. Since the media availability yesterday, we have no new positive cases. The total number of cases in our province remains at 261. By region, we have 243 cases in Eastern Health, 8 cases in Central Health, 4 cases in Western Health, and 6 in Labrador-Grenville Health. 52% of cases are female and 48% are male. By age, we have 22 people under the age of 20, 38 between 20 and 39, 39 between 40 and 49, 58 between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 4 people are in hospital due to the virus, and of these patients, 1 is in intensive care. 247 people have now recovered, and in total, we have tested 10,052 people. Now that we have a relatively low number of cases of COVID-19 in our province, we are in a position to keep this virus under control in our communities. However, this does not mean we can let down our guards. Rather, we must remain vigilant as ever, because as we know, a few cases of this virus anywhere can quickly lead to an outbreak of cases. As I mentioned yesterday, as we work through our plan for living with COVID-19, we will be closely monitoring the trajectory of this pandemic locally and globally as it continues to evolve. The public health orders in place will therefore need to remain flexible and adaptable as we move through our alert levels accordingly. And I implore you to follow the orders and the public health guidance at every level to help keep you and your loved ones safe. We all have an important role to play in protecting each other from COVID-19. Please continue to practice proper hand hygiene and cough and sneeze etiquette. Maintain safe physical distancing of at least 2 arms length from others outside of your bubble while you're in public spaces. And stay at home as much as possible, especially if you are feeling unwell. These measures have worked well for us to date and remained our best protection against this disease. I would like to acknowledge today, during National Nursing Week, the incredible dedication, skills, and contributions made each and every day by nurses in our provincial healthcare system, and particularly now during a global pandemic. Whether you work in acute care settings, long-term care, public health, mental health, or in the community, the courage and compassion you have shown under these challenging circumstances is truly commendable. We owe you a profound debt of gratitude, and I sincerely cannot thank you enough for your professional dedication and the personal sacrifices you have made and continue to make to protect us and help keep us safe. We are very fortunate for your service, and we cannot do this without you. As a recap for those who may have just joined us, we have no new cases since yesterday's media availability. The total number of cases in the province remains at 261, with 243 cases in Eastern Health, 8 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health. We have come a long way in the last 2 months, and the courage and resolution you have shown in the face of this pandemic is nothing short of remarkable. We are in this together, and I know without a doubt we will continue to meet this challenge head-on with the same vigor and determination for which we are so well known. Hold fast, Newfoundland and Labrador. Thank you.
Thank you, Dr. Fitzgerald, and good afternoon, everyone. No new cases in Newfoundland and Labrador today. That's well done, I would say, to all our residents, and that's 11 active cases. So we know this is as a result of the good public health guidelines that the Chief Medical Officer has put in place, and we have responsible residents that follow them. Now, over the last few months, we have put many measures in place to protect you and your families, and we would like nothing more than to see this result continue every single day. 0 cases is what we look forward to reporting to you on a daily basis. In fact, every day I'm also working with our opposition leaders, and I once again want to thank Mr. Chess Crosby and Ms. Alison Coffin to our joint Public Health Response Committee. We working every single day. We meet every morning, and we discuss many collective priorities, responses, and seek consensus on how we continue to move forward for the health and safety of all residents of our province. We all know that it's by working together that we will get the best results. We also know that what our Chief Medical Officer has put in place, like limiting the number of people that can attend a funeral, as an example, or attend a wedding, and restricting visitors to long-term care sites, that these are difficult decisions and they can often be emotional. As of yesterday, there's been a lot of questions about the number of travel request exemptions that we have in our province. As of yesterday, as the Minister had mentioned, was some 1,920 travel request exemptions that have been put in place. We also mentioned that now these can be filled out online and sent back for the response. So decisions, as I've mentioned, that comes with denying these requests, they're not easy to make. And we would love nothing more, as we all know, at a time when we're in some of the lowest points in our life and the difficult periods, we would love to be there to support our loved ones. It is a human instinct in all of us to console one another. But these decisions sometimes to not follow through and to say no are necessary. It's necessary because our objective and our priority is to save lives and to prevent the spread of this virus in our province. And I'm sure that is what matters most to you as well. And our government certainly appreciates the work that everyone across our province has had to adapt and adjust to this new normal of living in this pandemic time. Especially as we did yesterday, as moving forward into Alert Level 4. It is in times like this global pandemic that the importance of working together is truly felt. And it's about taking every single step we can to support you and your family as we continue to move forward in our plan through the Alert Level system. During this pandemic, we have focused our priorities to put supports in place for both the social and the economic well-being of all Newfoundlanders and Labradorians. It's support for residents, for families, and for businesses. And we will continue to work with our colleagues and the federal government and work with you to do whatever it takes to protect you and to support you as best we can during this time. Now, yesterday, the federal government announced supports for large and medium-sized businesses. And we also know that in our society that we have many seniors that have seen the negative impacts of this pandemic. So earlier today, the federal government announced a $2.5 billion national package to help seniors and provide them with a greater financial security. So if you're a senior that's living in Newfoundland and Labrador and you receive old age security, you will receive a one-time tax-free payment of $300. And if you're a senior that's receiving the guaranteed income supplement, you will receive an additional $200. So if you total that, the measure today that has been given will put $500 to seniors who are eligible to receive both the OAS and GIS. And this is meant to cover the increased cost of COVID-19. Now, as many of you know, that these benefits that I just mentioned are tied to your income tax returns. So to avoid any interruption in these benefits, you now have until October the 1st in 2020 to file your income tax. But you can be encouraged, but we still encourage you to submit your income tax as soon as possible. So if your 2019 income tax hasn't been filed yet, no need to panic. You have until October the 1st, 2020, and your GIS and OAS allowance, these payments will continue. We also know that there are provincial programs that are connected to the GIS as an example. We have two provincial programs that I just want to give you an update on. And one is your provincial drug card. And this is important for those of you over 65 that use this card on a regular basis. So typically this is tied to your income tax filing. This will now be extended until October the 1st in 2020. And the Newfoundland and Labrador Income Supplement is another program that we have available, and the seniors benefit, that will also be continued. And for those of you, I think the last payment on that would have been around October. That's a significant investment on behalf of the province. So this is meant to support the most vulnerable in our society, and that's our seniors, and they will continue to receive their benefits when they need them the most. Also today, the federal government announced the expansion of the New Horizons for Seniors program to an additional $20 million to support organizations that offer community-based projects, and many of our community organizations will be very familiar with this program. These projects reduce isolation, they improve the quality of life for seniors, and help them maintain a social support network. So while we've been announcing various supports for seniors, for families, and for businesses, we have also talked a lot about the importance of maintaining physical distancing. In saying that, it's very important to all of us important for us to remain active. So as long as you can, and not required to, and you can do so without self-isolating, of course, we encourage you to maintain the outdoor activities. This is good for your overall well-being. So if you're thinking about walking, hiking, or bike riding as an example, do so, but make sure you continue to practice safe physical distancing. Now, we have a great relationship with Participation, and that's an organization also that offers a free app with fun activities and ideas to help boost activity levels for people of all ages. So there's also a variety of resources on the Department of Children and Seniors and Social Development website. So if you're an older adult in our province, there are activities there that specifically designed to support you. And for children between the ages of 5 to 12 and for teenagers in our province, there's great tips on how you can swap the screen time for active play. So there are many resources that are available. Just to name a few, there's a kitchen workout, there's an activity motivation tracker, and there's a 7-day challenge that's available there. So I encourage you to take a look at those options. We also have added to this a number of community organizations across the province who are sharing some great ideas and resources on social media. People like the School Sports NL, Recreation NL, and Sport NL. Also for persons with disabilities, the Canadian Disability Participation Program offers free, but it's telephone-based physical activity coaching. This is for adults with a physical disability. So the key in all this, the message that I want to send out today, is important that you take care of yourself physically and mentally. Physical activity that can provide clarity and positivity through these challenging times. Not only is it key to take care of yourself, it is in times like this that will allow a greater thought on how you can help each other. There are people across our province and across the country that are unable to be physically active due to health-related issues. So right now we have about 4,000 Canadians that are on life-saving organ transplant lists. Now the reason that I bring this up today is anyone can be a potential donor, regardless of your age, medical condition, or sexual orientation. And while most donations occur following a death, there is a way to donate living organs like kidneys or liver. Organ donation can have a profound impact on the patients who are waiting for a life-saving organ transplant, but it can also have a profound impact on their families. So if you have some time today, I would encourage you, or over the next week, take some time to consider organ donation. Have a conversation with your family. Teach them the importance of giving life to someone else. There's an incredible stat that stood out to me. It's throughout Newfoundland and Labrador, we have more than 150,000 people who have indicated their commitment to donate an organ. So if you decide to sign up, make sure that your family is aware of the intent of you to donate organs after death. You can also register easily through your MCP card, as a form is available on the government website. And that, I guess, reminds us that we have, on the provincial government on your behalf, has extended MCP coverage to June the 30th. And this would include for all individuals whose MCP eligibility would have otherwise been expiring on March the 1st. So that's been now extended to June of this year. So I encourage you in closing today to keep up the great work, remain vigilant, and continue to maintain your physical distancing. We will get through this together. So joining us today by Skype is Minister Haggie, and I now turn it over for the Minister for some comments.
Thank you very much, Premier. Again, no cases, a flat line rather than a curve, and that's great news. Again, well done, Newfoundland and Labrador. It is, as was mentioned earlier, International Nursing Day. It's the 200th anniversary of the birth of Florence Nightingale, generally regarded as the founder of nursing in any form, really. So to all those nurses, the LPNs, the RNs, the nurse practitioners who look after us in a whole variety of places, across the healthcare system. Again, just take a moment for yourself between the jobs you would normally be doing. The healthcare sector depends on you. It is a key role that each of you play. We've augmented now as well the nursing profession with personal care assistants too, and our long-term care sector particularly is now heavily reliant on a new breed of caregiver. And so again, I think it'd be great to offer a shout out to them at that moment. There's also another occasion I'd like to mark on Mother's Day, which was the passing of a former colleague of mine and someone I was happy to call a friend, well known to people in the area in which he practiced, and that's Dr. Yonki Jian. I didn't realize that he came to Old Perlican originally back in 1966 before moving 2 years later to what was then Brookfield Cottage Hospital, where he practiced as a general practitioner and as a surgeon right up until the 90s and the early part of this millennium when I was there working too. So I did spend a lot of time with him. He was a man who was loved by his patients, a great colleague, and a really sharp clinical mind. He passed on his love for medicine to his children, and at least one of them that I'm aware of has followed in his footsteps. So from a grateful province to a grieving family, we remember him too. In terms of where we are at the moment, one of the topics that came to light recently was correspondence from CODNL and the Association for Community Living, expressing some concerns, not so much necessarily about what was or wasn't happening in this province, but issues that have come to light more on a national basis. And I'm thinking of things in British Columbia, for example. These organizations represent the interests of people with significant cognitive challenges. Their concerns were centered really around two things. One was the issue of support persons with them in hospital and when they receive care, and the other was around access to certain elements of care. Certainly from the point of view of support people, the discussions around that in the early stages of COVID-19, when we were still all learning, was centered as much around the safety of the support worker and support people as it was any other factor. But I think we have landed provincially in a good place in that for those people with cognitive issues who require a support person, that individual is able to stay with the individual who's admitted receiving care, bearing in mind the needs of PPE and some clinical safeguards. There were concerns about the risk to support workers, and I think we've managed to deal with that. The other piece was around access to technological treatment, intensive care, those kind of things. And what I can say to any and all of you, Newfoundlanders and Labradorians, is that the decisions around who gets what in the way of clinical care are made by clinicians. They're not made by anybody else. There are no exclusion criteria that are not based on sound clinical decisions around whether or not that treatment is actually suitable or appropriate. No other consideration. And I'd like to reassure ACNL and CODNL that is in actual fact the case. Fortunately, the demand on the healthcare system from COVID-19 has fallen in the hospital sector into a very manageable area. One of our concerns as we start to move towards relaxing some of the restrictions we had to put in place is how best to preserve some ability to respond to a surge in patients when and if the second wave will come. We have a period now where we can start to look at a balance between the needs of people whose care may have been delayed or deferred a little bit because of COVID-19 to try and make sure that their needs are addressed. But it has to be done on a balance, and it's a multi-legged stool. It's not just three legs, because we need to look at beds, we need to look at demand, we need to look at human resource and staff, but we also need to look at PPE, and that has been a challenge. We've been able to meet that challenge, but again, if we expand the demand on PPE by doing more in in a planned way, that is something we really need to monitor closely. We've got some standard tools for doing that. We're working nationally as well to look at some modeling around that, and I think that will be very helpful. Planning, not so much the step from alert level 5 to 4, but as we move into alert level 3, should we continue to be successful. And that really brings me to the last challenge that I see over the next 3 weeks, nearly 4. We've seen the prospect of moving away from an unnatural way of living and an unnatural way of relating to each other. And I think there's a great tendency for momentum to build and people to want to rush towards the end goal. And I would really caution very strongly, as Dr. Fitzgerald has done, that rushing now will simply make us trip, and that we need to hurry slowly. And if we don't, then we will find ourselves potentially having to go backwards. The other caution I would make is that even when we get where we're going, which at the moment is alert level 1, that is still not what you and I would understand as normal, nor will it be until such time as we have an effective vaccine widely available and widely used by people in this province. We have an excellent record with childhood vaccinations. We lead the country in getting our children vaccinated. But when it comes to the flu vaccine, which needs to be changed every year, we do not do very well. As my daughters would once say, we suck at it, and we can do a lot better. And hopefully people will see the wisdom when a COVID vaccine comes of using that. The other piece of that as well is research is also ongoing into finding a specific antiviral treatment for COVID-19. And hopefully that will continue and be productive and be effective, because, again, this is a virus we've never seen before, and it can change, and there is evidence it might actually do that and turn into an annual visitor rather than one we adapt to living with on a regular basis. So we've done very well as a province. We're one of a few who have really and truly flattened the curve. I think we have the opportunity now to take a gradual return to normal and do it in a way that is safe for all of us. We all know that we need to get back to something where we are economically and socially more interactive and connected than we are at the moment. But if we rush it, we run the risk of wrecking it. So again, stay in your bubble, bigger as it may be, protect it, and don't damage anybody else's. Respect theirs too. And I think if we can continue to do that, we'll get through to a situation where level 3 will be a reasonable prospect. So with that, Premier, I'll hand the meeting back over to yourself.
Thank you, Minister, and thank you for your wise words again today. I will now turn it over to the media for today's questions.
Thank you, Premier. For the benefit of our speakers, we have 6 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Please do not press star 1 until your name has been called. Following this, should time permit, there will be an opportunity for single questions. This call will end at 2:59 p.m., and further questions can be emailed. Our first questions today are from Peter Cowan of CBC News. Please go ahead.
Premier and Minister Haggie, the right for people to gather together to protest measures they don't like from a government is fundamental in a democracy. We saw today the police shutting down a protest by fisheries people who are concerned about the measures the government is and isn't doing. What do you say to people who are concerned that health measures are being used to stifle a fundamental part of democracy?
I'm not so sure that health measures are being used. We put in guidelines to protect all Newfoundlanders and Labradorians, and we do understand that people's right to gather under normal circumstances is something that, actually is fundamental to democracy. But we also know that these are not normal circumstances, and there's been a number of special measures orders that have been put in place that would limit the number of people that can actually that could be organized in a gathering. The enforcement, is the responsibility at this stage of the RNC or the RCMP, so they would make a decision on indeed if any of those special orders are being challenged. So these are decisions that have been put in place during these very special times in the history of our province. The right to organize under normal circumstances is something that's fundamental to our democracy and something that we would encourage in normal times.
I have a couple questions about testing. Looking at the per capita rates, we're the third lowest in the country. Other provinces with low numbers like PEI and New Brunswick are doing a lot more testing. Why are our testing numbers so much lower, and what would you say to people who are concerned that we're not testing enough?
So when we're testing, we have to have a reason to do the test. So what we know about this test is that, there's nothing that's perfect. So there is a chance that you can have false negative tests. There's a chance that you can have false positive tests. And when you have a low prevalence in your population and the chance of the test being positive before you do it is low, we know that those risks are higher. So you have to be cautious about that. A lot of the places that have higher testing rates also have higher infection rates, and so you're going to be doing more testing when you find more cases. That just follows logic. We're constantly looking at the information out there about testing. We're looking at epidemiology and what we should do. We've broadened our testing criteria, but we have seen a significant reduction in symptoms as well. So, at the moment, we are following the best information that we have and the best scientific evidence to inform our testing strategy.
So, Peter, the other
I had that discussion.
Yeah.
Sorry.
Yeah. It's just a quick comment on that. The other thing is how provinces report, Peter, is not every province reports the same. As an example, Newfoundland and Labrador, along with Quebec, along with Nunavut and the Yukon, we report by the number of people that are tested, not on the number of tests that are performed. You could have an individual that could be tested, 5, 6 times, and we've seen examples of that in recent days. So we report on the number of people tested, not the number of tests performed. So therefore, you would know, even with the way we report would be lower. But if you also look at Eastern Health, where 93% of the cases that have been confirmed positive would be located. So if you look at those numbers and you look at the people that have been tested, even not adding the number of tests that's been performed, we are really in the middle of the pack. So as the Chief Medical Officer has said, is the reason for testing when you chase, those through contact tracing is connected to all of this as well. So it can get complicated, but we need to be able to compare, the systems like all provinces, and we're not doing too bad when you consider the way we report.
Peter, I think the fact that each of us wants to chip in on testing reflects the amount of discussion provincially and nationally that's gone on about it. I was on a health minister's call last night, and the use of testing came up yet again, and we had some questions for Dr. Tam. I mean, we follow the Public Health Agency of Canada guidelines for the use of this test. I think the important thing people need to really recall is that this test is what's called a diagnostic test. It's used for treatment. It is not a screening test for COVID-19. There is no screening test for COVID-19. The best screen for that is 14 days of isolation. And you notice how pretty well every order, every recommendation has emphasized the importance of the use of isolation regardless of the test result. And we go back to the comments I made weeks ago, which was if you had a positive test, you isolate for 14 days. If you have a negative test, you isolate for 14 days. And if you're not well, you stay home in the first place. So that's part of the discussion at a national level. And we are keen to see where we can go with that next. But it's got to make sense.
Can you give me an idea then, as we move forward and ease restrictions, what is our capacity to do testing, and how do we see that testing playing a role in being able to relax restrictions while also still identifying who has the disease and isolating them?
Using the current test, we have the capacity to do 700 tests per day. Per machine, we have a second machine. When that machine comes online, were we to staff 24/7, we would be able to do somewhere of the order of 2,600 tests in a day, reagent depending. We've had discussions with both the health ministers and the procurement ministers about ensuring that should we need it, we would have a sufficient supply of reagents for both machines, bearing in mind sometimes the ferries across the Gulf don't run, and that's an ongoing discussion. Our usage of testing is nowhere near our practical or theoretical capacity maximum.
So I think, Peter, you kind of nailed, one of the things that's fundamental in moving through the alert system is you must have the capacity to test if you have to respond to a flare-up or a setback as we move through the alert system. So I think it's important. I think you've nailed it, and the capacity is within the system to be able to respond if need be.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Minister Haggie, you talked about preparing for a second wave and that one could be coming. I'm wondering if we have any indication or modeling that could give us a time frame on that.
The modeling that we have currently and not been revised recently is the ones from CAI that Dr. Rahman presented. Public Health Agency of Canada and national monitoring suggest something similar, and they're looking towards the fall. So at the moment, those simulations are rerun on a regular basis. I haven't seen a new one for the last 10 days or so, but I know that modeling and predictive analytics is still on the go. Our group meets on a regular basis, usually on a Tuesday night.
Thank you. And we know it's on the agenda for Monday this evening, looking at only having online classes through the fall. Do you think that it's reasonable for schools to consider that they won't resume in the fall?
So I think, what we do is we plan for where things would be in the fall from the education system. I know just speaking to, members of the that department or some of the officials within the department, just recently is, we're planning for the fall for two scenarios. One, if the school could return, what normal in-classroom instruction would look like. And secondly, if we're in a position that we cannot return to, what has been the history in our province, how do we provide, distance or education from a distance to those students? Right now, we're well equipped. We have about 4,000 people that we've identified students that would require some supports, and about 25 of them have already been. We've already had 25 distribution of Chromebooks, iPads. As an example, there's another 1,500 on the way. So we're preparing, and we've checked out, where Wi-Fi would be. And there's less than 300 situations right now where students would require support there. We're working on that now. So we're positioning and planning the department for September under either scenario.
Thank you. And Premier, we know we discussed this just recently when it comes to the wage top-up and the province contributing. You said a plan was in the works. I'm wondering if we can get an update on that and how the province plans on making sure that the workers get this and not the owners of some of the private companies.
Well, for sure the workers will get it. That is one thing I can guarantee you right now. So right now, we will be participating for essential workers within our province. So the plan right now is we have to submit our proposal to the federal government because it is a cost-shared arrangement with the federal government and the province. So that plan will now be submitted from the Department of Finance. And what we do know is that it would be a reward or an incentive, a one-time payment. It's a 16-week incentive program. The program will end on July 4th, so that incentive will be paid out to those that have contributed and have been impacted through the decisions that have been made during COVID-19. So it's an incentive for us. We will be participating with the federal government. That proposal is now waiting for for approval at the federal level. Excuse me. Thank you.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Peter mentioned we saw another large demonstration in front of the FFAW offices today. That's two demonstrations with more than 200 people, not necessarily following socially distanced or social distancing practices. What does that say about the efficacy of public health rules that are in place right now, and is there any plan to change things given that in such a short period of time we've seen such two large demonstrations and no consequences?
For us, what we can do is put in the legislation that the enforcement officers would require. Of course, enforcement is not the preferred option for us as a government. We would rather that we be able to work with those groups, like the groups who are there today. So right now, what I understand, there has been some involvement with the police with this protest today. So the enforcement is not a preferred option. First of all, is be able to do things safely, and there are ways to get the message, to those that are impacted. And we know these are difficult times for fish harvesters and plant workers and all those involved in the fishery in our province right now. But I also understand that the processors, along with the harvesters, have been able to make some changes into trip restrictions in this morning as well. So there's been improvements there, and certainly we're open that we can come to a resolution for this. Fishery is very important to Newfoundland and Labrador in all our communities, in particular rural areas in our province.
That the protest seems to be moving or making its way to Confederation Building now. From a public health perspective, do you have a message for protesters?
So right now, safe physical distancing is extremely important. There are measures in place. We know there are law enforcers, that would be monitoring this. As we understand, the people's rights to demonstrate under normal times, but we must be mindful that you must do things. This is to protect the safety of Newfoundlanders and all Labradorans. We all know, and we've seen in our own experience in our province, and we've seen, what's happening in other provinces outside of Newfoundland and Labrador, that this is a virus that it is in our communities, and the ability to spread amongst us. We must always be mindful of this. Our plan says living with COVID in Newfoundland and Labrador. It's here, and it's gatherings like this that can actually be very dangerous for people, and it can help spread the virus within our province. So, it's important that we follow those rules. The messages and the way we send our messages to government and to organizations that will be impacted here. We want to work with you, but we want to make sure we do it in a safe way.
The Canadian Civil Liberties Association plans to mount a charter challenge to the province's travel restrictions. That association says there's no evidence that banning people from coming here is a reasonable and justified limit to charter mobility rights, because less strict measures were in place. When less strict measures were in place, the vast majority of people were still following the rules, and we managed to flatten the curve. So they're asking, why take this extra step of banning non-residents from entering Newfoundland, Labrador? What do you say to that?
Well, what I would say to that is when you look at how we spread the virus around the province and how it enters Newfoundland and Labrador, we know that a number of the positive cases that would have come into our province or that have been identified here through contact tracing would have been travel related. So it's important for us, first and foremost, to stop the spread of this virus amongst us, and therefore having to put in tougher measures in place so that from a traveling perspective, we take the proper due diligence that was required. So this enforcement measures was something that the RCMP and the RNC, our police officers, identified that they did not have did not have the legal authority to enforce the measures that were put in place, and that is why these changes were made. They were made to protect Newfoundlanders and Labradorians in these abnormal times.
Patrick, if you look at other jurisdictions...
You've already had 3 questions, Patrick. We have to move on.
That's the minister. That's the minister there, Kathy Adams.
Oh, I'm sorry.
Don't fret. Patrick, if you look at what's happened in other jurisdictions and the idea of adaptation and living with the virus, every jurisdiction across the globe has regarded border control as a key issue. Within Canada, that is also the case. If you look at PEI and New Brunswick and the territories, they have very strict border control. New Brunswick is turning away on average 35 motorists each day at their road crossing. We don't have a road crossing on the island. There are some in Labrador. So the most of our travel would come in through ferry or by air. New Brunswick has actually detained, returned 19 other travelers since their travel ban came into place. PEI turns around vehicles on the Confederation Bridge. This is not unique to Newfoundland and Labrador. And I would argue that if you look at New Brunswick, if you look at PEI, you look at the territories, and you look at Newfoundland and Labrador, there is a common theme there around our success at flattening the curve. Those jurisdictions that have not been able to flatten the curve are in a different situation vis-a-vis their border control. The only other one I know of is Quebec, and they have struggles of a different nature.
My apologies to you, Minister Haggie, and also to you, Patrick. This is day 65 of us doing these types of events. So we'll move on now to Ben Murphy of VOCM News. Please go ahead.
Thank you. Premier, I just wanted to go back to the fish process there for a moment. You said yesterday that government can step in and mediate if necessary. So why not just step in and mediate this so these fishermen, these protesters don't need to go out and put themselves and others in danger like we're seeing right now?
Well, like all mediation, there's a requirement there, or usually you're called for mediation to support workers. We put this out there. We're available. We have people that would be willing to work. But it seems to me that there's been a recent meeting that they've had. They're working on those issues themselves. It's really an issue between the seafood processors and the fish harvesters. We recognize, these are very challenging times for the harvesting sector in our province right now, and indeed for the fishery in a general way. So right now it seems like they're working on this, they're having their discussions, and they're working through. And we've seen recent, I think from what I've seen just recently, is that they've been able to actually, in terms of trip restrictions, increase the volume in terms of the amount, the number of pounds. It was at, for a single owner, it was at 1,500 pounds. It's now been increased to 3,000 pounds. And for those that are doubling, it would have been from, it was from 3,000, it's now moved up to 5,000. So we've seen some changes already, and we just certainly, if mediation is required, we can be there to support them.
And Dr. Fitzgerald, wondering what government is doing to provide support for those with disabilities who may be in hospital or going for appointments.
So people who have disabilities, you mean with regard to support people?
Sorry?
So
no, just people with cognitive disabilities.
Yeah, so if people need to have support people to help them attend appointments or to avail of medical services, then certainly those support people are permitted to join them.
Okay, so I'm hearing from the Coalition of Persons with Disabilities that some people who need support are being denied that family support in the system. Government, one of the pages I believe says that patients living with significant cognitive disabilities can have a support person if deemed appropriate by the patient care team. Why does this need to be done by the patient care team rather than, let's say, the family who knows that this person needs support?
If I could jump in there, Ben, there was one incident in Western Health right back at the beginning of the outbreak when there were fresh cases being announced daily, and there was a discussion to be had there. I referenced this in my opening comment. The fact is the discussion is around what constitutes a support person or a support worker. The issue from the healthcare perspective is the risk of having multiple people over multiple days with one individual. It's a risk to the support workers as well as everybody who comes into contact with them. So the discussion is about who and under what circumstances a named or a couple of named individuals would share the responsibility of providing support, not whether they get it. It's the detail as to how that could be worked out. And then, of course, there are clinical elements that might need to be brought into play depending on what care needs to be given to the individual at any given moment. Since that incident in Western many weeks ago, I have not been made aware of any specific case. If you have new news and some information, we'll be happy to look into that for you.
All right, great. Thank you very much.
Our next questions are from Elizabeth Witt of All Newfoundland Labrador. Please go ahead.
Thank you. Earlier today, we reported that Suncor is suspending production at Terra Nova until 2022. What impact is this going to have on the province, especially in the midst of a pandemic, and are you concerned about the future of that production?
Certainly, we're working very closely with Terra Nova. I just had a conversation with our minister just prior to coming to this media availability today. It's recent news. And of course, the offshore industry has undergone tremendous challenges within the last few months in terms of the price of oil. And of course, with Terra Nova, they've had some other challenges as well. They have not been producing since December of this year. This is a field for us that's been extremely important. It's been around a long time. In terms of the royalties that's generated from all our fields offshore, in terms of percentages, Terra Nova would have been the highest. The dollar value, of course, would be Hibernia. But right now, it's some challenges. We're more than willing to work with the company there to see what it is that we can actually do from a provincial level to support the company. But we also recognize that there's a lot of challenges globally with the oil industry. So we're willing to work with the company. We recognize how the important impact they would have, this has on our province.
Right, and we've heard much from the industry about how they want the federal government to help with financial support and regulatory reform. But can you speak a bit more about what the province can do to stem job losses and the royalty revenue in the province at a time when we can kind of ill afford that kind of action?
I agree. So one of the things that we've been able to do as a province is certainly advocating. There's been we put a tremendous, effort into regional assessment as a means to attracting investment into Newfoundland and Labrador. We anticipate that is still on track for near the end of this month, that assessment would be done. But really, when you come down to the short term, the immediate, what can be done? So we'll work very closely with that industry. But, when it looks to attracting capital investment to Newfoundland and Labrador, there's a global challenge here, and people, when you invest, if you're an oil company and you're looking for a place to invest, first of all, you look at what the jurisdiction would be federally. So it's important now that we continue to work with our federal partners. Yesterday, we saw some of that addressed with liquidity measures that will be able to support the industry, but there's much more that needs to be done. We know that we need to attract more exploration here to extend life of fields, but open up new fields as well. And regulation, as you just mentioned, is certainly from a provincial perspective that we can look at, but we also know that the regulations are both federally and provincially controlled here. We will do everything we can to support this industry. It's over 30% of our GDP. It has a tremendous impact on the financial stability of Newfoundland and Labrador.
Thank you. And my follow-up, my next is more a question for the Minister or Dr. Fitzgerald. Typically, it takes 2 weeks for someone with virus to recover. And is this what we're seeing in our province, or have there been cases where it's dragged on longer and people have waited longer for it to clear up?
Yes, so on average, people usually are better within the 2 week period, but some people with mild disease get better very quickly, and some people who have more severe disease take much longer to recover. And of course, we're still fairly new in our experience with this virus, and so some people may be left with longer term sequelae that we don't know about yet. So it's really, it depends on severity for the most part. Milder disease tends to get better quicker, and people with more severe disease, it tends to last longer.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
The Eurohome cluster happened at a time when people were very unaccustomed to physical distancing, and the small reaction to our flat line seems to suggest a certain pessimism about residents' ability to avoid that same kind of close contact and their ability to practice physical distancing. Why is there so much pessimism about the people's ability to behave responsibly?
I think for the most part, Peter, what we'd see is that we have seen a tremendous amount of compliance within the overall general population of Newfoundland and Labrador when it comes to, being compliant with the public health measures that have been put in place. Unfortunately, we do find ourselves where some individuals will be a little defiant on what practicing, say, physical distancing, as you just mentioned. But I think if you just look at any evening news hour at all, this virus is in our communities. This is in every single province. We've had 70,000 Canadians that has been positively impacted by this virus. And right now we're seeing this still doubling at a rate of every 23 days within Canada. So simply to think that, we can actually ignore the fact that this virus is not spreading and can spread rapidly amongst us. And this is why we put into working with the Chief Medical Officer, that we put the measures in place. It's to protect Newfoundlanders and Labradorians. So if some people don't follow all those measures, well, there's enforcement measures that we have out there. And unfortunately, this is not something we want to see enforced. I think education is our best option. But let's not forget that it's still very active in this country, and it can be active in Newfoundland and Labrador if we don't follow those health guidelines.
Okay. I just wanted to ask if there's any kind of an update. It's been a week and a half since 99 health scientists employees were sent to quarantine. Is there any update at all on the patient or the staff members in terms of testing?
I'm sorry, I'm having a bit of difficulty hearing you, Peter.
So the update.
The health sciences employees who were sent into quarantine, I'm wondering if the patient involved in that or the employees, whether any extra testing has been done and what it's telling you.
So my understanding at this point is that the employees have been tested and that nobody has turned up positive in those employees. And as far as I know, there's nobody who's been unwell. Which, I mean, that's a good sign that the chance of transmission is low. But again, we can't. We have to wait that 14-day incubation period before we can say we're in the clear.
Okay. And the last question I have is the St. John's mayor has expressed concern about the number of people mingling in parks rather than walking through. It's only been open for a day or so, and already people seem to be missing the point. Is this kind of increase in unsafe practices, would that actually influence your decision to move on alert levels, or is that almost entirely based on the number of tests?
So I think, we have a lot of indicators that we will use to determine whether we move from one alert level to another. And that has to do with, the amount of disease we see in the community and things like hospitalizations and PPE requirements and healthcare capacity. Whether or not people, the behaviors of people in and of themselves may not influence that decision. However, I would never say never, so sometimes those behaviors may. But, we had to remember when we hear about things like this that people may be mingling, but they may be mingling within their own bubble. And, if you have two family households that have 4 or 5 people in them, that could be 8 to 10 people who are walking together, but still within their bubble. So what we're asking you to do with physical distancing when you're outside is to stay in your own bubble and to physically distance from other people. So we have to be careful about what we take away from certain situations. And what we know about outdoor transmission so far says that the risk is lower in those situations, and that certainly, the length of contact that you're having with someone influences the transmissibility. So passing by somebody is certainly not to say that we don't want people to physically distance, but, the risk is relative. And the more time you spend with someone, the more likely you are to spread the disease if you have it. So, just because people may pass by each other in the park does not mean that they're going to pass the disease on to each other. However, obviously physical distancing in those situations is still important.
We have time for 2 quick questions, so I would ask reporters to press *1 and identify yourself, please.
Kelly Ann Roberts, please. Thank you. Minister Haggie, I don't know if you want to speak to this or somebody else on the panel, but in terms of the protests we've seen happening and the breaches in the public health measures, are people just at this point starting to feel like they're empty threats about getting charges or tickets laid, that we haven't had any done here and people are blatantly disregarding public health measures?
I think that's an interesting question, Kellyanne, and I referenced in my remarks as well the challenge of momentum and hurrying slowly towards what may be our new normal. we had commentary from the RNC and the RCMP that they needed some additional tools to be able to enforce the measures under the public health state of emergency. We went back in the House of Assembly and provided those tools to the RCMP and the RNC, and the issue around how and when those are enforced is something that peace officers decide, nobody else.
Thank you.
And our final question today is from
Peter Collins.
Go ahead, Peter.
This is a question for Minister Haggie. Early on, you said you were dropping the interim title from Dr. Fitzgerald's job title. Some people have been concerned they've seen there's a job posting up for a Chief Medical Officer of Health. Are you still looking for someone else for that job?
No, my understanding is that that's kind of been left there simply because we have been focused on other things. I am not at all unhappy, and in actual fact, I'm delighted with the current Chief Medical Officer of Health. And I think if you listen to the comments from the panel, whatever job evaluation may have been necessary has just been passed with flying colours.
Thank you.
Thank you very much. The time for questions has ended. Please join us again tomorrow at 2 p.m., 1:30 in most of Labrador. Have a great evening, everyone.